Good morning. This is Dana Parsons with LeadingAge Virginia, and welcome to our weekly member call. Thank you so much for taking the time out to join us today. Before we get started, I just wanted to mention that we have recently announced a legal issues around COVID-19 webinar series that will offer 4 CEUs. The first one is on June 30th with Hancock Daniels, and we'll be discussing statutory immunity protections during that time. So I hope you have the opportunity to join us. So let's go ahead and get started. If I'll hand it over to the Virginia Hospital and Healthcare Association with Kelly or Matt.
Good morning, Dana. This is Kelly. Just confirming you can hear me?
Yes, thanks so much for joining us.
Great. Thank you, and good morning, everyone. Just wanted to provide you a brief update from our Virginia Healthcare Alerting and Status System numbers. As of this morning, we have 727 confirmed COVID-19 residents within skilled nursing facilities as reported to us through VHAS, and 363 residents that are pending COVID-19 confirmation, and a total of 1,910 confirmed recovered residents. I will say that these are a drastic decrease in numbers that we've seen over the duration of the response, which is a really fantastic sign, and can't thank you all enough for the continued work on the front lines to ensure the safety of your residents within your facilities. We continue to monitor this as well as the hospital numbers as it relates to reopening and what type of an impact that would have on facilities. One thing I do want to note that is if you are a registered VHAS user and you receive the situation report from us daily, it goes into the more detailed granular specifics related to individual facilities, and the pending numbers, pending cases does jump pretty drastically, and that is just in correlation to PPS surveys that are going on within facilities. So we will have facilities that may have had a PPS survey, and so all 100% of their residents are listed as pending, as they should be. And so if you look at some of the aggregate numbers in each of the regions, you might see a drastic increase or decrease from day to day as it relates to pending numbers. And we've seen the direct correlation for those facilities that are, as I mentioned, having the point prevalence surveys. We also continue to monitor the PPE needs. We are down to just 7 facilities that have reported difficulty obtaining PPE. I think this is fantastic. You know, our healthcare coalitions have been working with you all very diligently, as well as with the state, and I know you all are doing everything you can to procure supplies on your own, and I can't thank you enough for that. We will continue to monitor this as we go into the fall, as potential surges happen, if they do, if the modeling proves to be accurate, and we'll continue to monitor this data element and support in any way we can with the supplies that we receive from the state. And with that, Dana, I'm happy to answer any questions.
Well, I do not see any questions in the chat box, but we really do appreciate you being on today and hope that you can stay on for the remainder of the call. So thanks, Kelly. We really appreciate it.
Hey,
now,
Dana, this is Robert. I actually have a quick question.
Sure, go ahead.
Robert Atkins. Hey, I was wondering with the VHAS reporting, when we have residents going out on medical appointments that we are testing and they're being isolated when they return, should we be considering them in the, I guess, pending category? Or are we only doing reporting for people that we would consider to be truly symptomatic for COVID-19?
That's a really great question, and we look at this from kind of 2 different perspectives. So one of them is if there's an actual test pending, then they would be listed as pending. If you're just quarantining them on precautionary basis, then you don't necessarily need to list them as pending. However, where we do get into a little bit of the gray area, and we've seen this with our hospitals as well, is that if they are taking, if quarantining a specific resident is taking a significant amount of resources, so if your staff is going in full PPE, just as precautionary, then you may want to list them as pending, but it's not a requirement. So it is a little bit of a gray area. I would say if they're symptomatic and they have a test pending is what we would really look for. But if they are taking up a significant amount of resources, then you could consider them pending as well.
Thank you.
Thank you, Kelly. So we're going to move over to Virgie Fields with the Department of Health to provide us with an update specifically related to PPS in assisted livings, an infection control grant, and some other updates, any updates that the department has. So over to you, Virgie, and thanks for joining us.
Hi, thank you. Can you hear me okay?
Yes, we can.
Okay. Thank you. So good morning, everyone. As far as that updates on our numbers, we're reporting on our website as of this morning a total of 55,775 total cases. That's an increase of 444 since yesterday. Total hospitalizations are 5,692, which is an increase of 49 since yesterday. Our total deaths are at 1,583. 13 new deaths were reported since yesterday, and we're at a total number of outbreaks at 423. Of note, on the VDH website, there is a new blog post under the Data Insights tab that describes the changes to how we are currently presenting race and ethnicity data. If you have an opportunity, check that blog post out to see what the changes are and how our data are a little bit different this week. Getting into point prevalence surveys in assisted living facilities, I know a few associations have already sent this information out to their member facilities, but we just wanted to take some time to mention it here. VDH is offering to conduct COVID-19 baseline testing in assisted living facilities for all residents and staff in June and July in alignment with best practices for reopening facilities. The Virginia National Guard partnered with VDH as a resource to Virginia to increase COVID-19 testing in the Commonwealth. The National Guard has become experienced in collecting specimens for COVID-19 testing with 35,000 under their belt in facilities that have initiated this testing, most of which occurred in long-term care facilities. Prior to June, point prevalence survey testing, or PPS, in facilities was initiated from the facility. VDH is refining its point prevalence survey testing project to be more efficient and is initiating the request to each assisted living in Virginia to offer this service. Assisted living facilities should expect a call from the National Guard in the coming weeks to take advantage of this service. So just a little background, a point prevalence survey is testing of all residents and staff on any given day. It is important to go through the VDH guidance that is posted on our website prior to conducting a point prevalence survey and take those necessary steps to prepare your facility, residents, and staff for the testing and results. The guidance can help your facility to prepare and understand the interventions that may need to be implemented based on testing results. Once scheduled, VDH will also provide an Excel template for you to provide a list of your residents and staff to make the testing day more efficient. You will need to provide certain information for all residents and staff. It may help to start gathering this information now and to go through the VDH checklist, including in the guidance on our website, to help ensure you're ready for your point prevalence survey when it is scheduled. PPS testing via the VANG is free for the facility residents and staff. The VANG will bring all of their own supplies, including PPE. If you have any questions or would like to schedule an assisted living point prevalence survey, please contact your local health department or Christine Gray or Kristen Collins. And I can include the VDH guidance for point prevalence survey testing in long-term care facilities, as well as the emails for Christy and Kristen.
Hey, Virgie, could I just mention something real quickly? So we included this information in our update yesterday, as well as the contact information that Virgie mentioned if anyone wants to go ahead and reach out and have this set up. We are going to be reaching out to you today to collect the best contacts for the department to contact at each of our member communities to set this up. So I just wanted to let you all know that we'll be reaching out to you today. You can send us back who you would like the department to contact, because we've been asked by the department to compile that information for them to assist with reaching out. And we
Great.
just had
Thank you for that.
Yeah, absolutely. And Virgie, we just had a question come in. Will there be a mandate to test in assisted living?
I believe I will defer to, that will be under DSS. I'm not sure if Carol's on the line, but we are currently waiting on some approvals for, at least for a nursing home, to have a mandatory testing requirement. I'm not sure where DSS is on their reopening guidance. I'm not sure if anyone on the line is from DSS.
Yeah, this is Dana again. We're not aware of that. We understand some guidance is being developed, and we have invited the Department of Social Services to be on our next call. But if we learn anything between now and our next call on the 24th, we'll certainly let members know. But please plan to be on the 24th call, because we do hope to have DSS present at that time.
Thank you. All right, and I just wanted to provide an update on this infection control grant. So Virginia has received additional federal funds to focus on infection prevention and control training. The goal is to train frontline healthcare workers on incorporating infection prevention practices into their day-to-day practices. So recent major outbreaks, including Ebola and SARS, and now COVID-19, have demonstrated that infection control knowledge sits with a few practitioners, such as the IP and hospital epidemiologists. There is a need to train the entire frontline workforce on the rationale of infection prevention measures so they can respond with understanding instead of fear. CDC is developing IPC training that moves away from slide sets and uses various platforms that may include social media, YouTube, and podcasts. Activities will include conducting high-level training, needs assessments of, and provide a summary report on Virginia's healthcare workforce to identify training gaps by setting, describe primary spoken and reading languages, and characterize literacy levels and age. To promote awareness and facilitate uptake of IPC training and education content provided or approved by CDC. This could include leveraging licensing and certification requirements. And 3, conduct and convene trainings for frontline providers, including establishment and implementation of remote learning capabilities. So we are looking at expanding ways of presenting IPC education, as we recognize large group education sessions are not feasible during the pandemic. We want all frontline providers to feel confident in infection prevention education and not fearful. We would like to convene a small work group of providers and other interested staff to develop some proposals for using funding to bolster infection prevention and control. So if you're interested in engaging in this initiative, please let us at LeadingAge know. I can also leave our general HIAR inbox, our email address in the chat box if you're interested in joining this work group. And that was it for me.
Yeah, thank you, Virgie. We actually sent you someone who's interested in serving yesterday. So if anyone is on the call and is interested in serving on that work group, please let me know and I can pass that along. Just one question. Do you have a timeline about when the training may occur so it would benefit communities?
Sure. I don't have a timeline, and I can ask around and try to get that for you to send out. But as far as I know, only thing I know is this is a 24-month funding. I'm not sure when it'll start.
Okay. Well, as we know more, we'll continue to share it with our members. Well, thank you so much for that update. And if we have any questions, now's the time. If you had any related to the point prevalence surveys and assisted living. Okay, I know our members have had some great experiences with the National Guard. I know that's been a very positive process for those that have participated in it. So thank you so much for the update on that, and I hope you can stay on if you're available. So thank you so much for that update. So we are going to move on to discuss a resource for infection prevention and control assessments within long-term care. So Angela, over to you with the department. Angela Spleen with the Department of Health.
Okay, good morning, everyone. Again, I'm Angela Spleen. I work on the HAI-AR team at VDH, and I'm coordinating a proposal that has been submitted to and approved by HHS to receive health and medical task force teams across the Commonwealth. We've discussed this proposal with the COVID-19 Long-Term Care Task Force and are very thankful to Dana for inviting us to talk about this resource with all of you today. So to start with a little bit of background, the infection control team at VDH was made aware of the possibility to submit a proposal to HHS to get federal assistance in responding to COVID-19. Other states have used this resource in various capacities. In Virginia specifically, we wanted to focus on infection control. So the HHS teams that we are looking to bring in, they will help provide a non-regulatory infection prevention and control assessment in facilities, kind of who need these assessments to progress through reopening phases, or these facilities can just really just take advantage of this resource of these teams to provide, specialized attention, facility-specific solutions, ensure readiness, particularly keeping in mind the reopening process, and for the facilities this applies to, provide feedback ahead of regulatory CMS surveys that are scheduled to happen by, I believe, July 31st. Some important things to keep in mind about these teams and the assessments: it's completely voluntary. The teams will be using the COVID-specific CDC ICAR tool, and these HHS IPCA teams will bring their own PPE, so that's not something that needs to be worried about. In the proposal, we requested 12 teams of 2 to 3 infection prevention and control specialists who will be assigned regionally to conduct assessments for a 30-day period. There is a possibility, depending on the response and the requests that we get, that they could be deployed for longer than 30-day periods, but that is a whole separate process we'd have to go through. So it's important to keep in mind that we only have them here for a short period of time. We still haven't received a final workforce count, but we expect it should be similar to our request. We did find out that these teams will be staffed by infection control nurses from the VA. And this is a very fast-moving project. We received word of approval on Friday and have been told that we need to be able to start by this coming Monday, which means we'll need to have facilities identified and scheduled by next Tuesday, June 23rd. So in order to maximize the time and the resources provided by these HHS IPCA teams, we need to determine which facilities need and want to have these assessments. We're offering this to all long-term care facilities, skilled nursing facilities, assisted living facilities, whoever wants it. We've already asked our local health districts to share lists of facilities that they know of or think might want to take advantage of this resource. As I said, we've discussed this with the partners in the long-term care task force to ask for their assistance in kind of identifying facilities and sharing this information. And really, the infection control team is hoping that the facilities on this call will directly contact us to volunteer for the HHS assessments. We're really looking for help endorsing and encouraging this resource, and most importantly, getting facilities on the schedule. And again, it's likely that we'll only have these teams for 30 days starting next Monday. So we're asking if you can share this information or kind of get in touch with me by this Friday, June 19th, or even earlier if possible, to get on the schedule. I apologize for the time crunch. I know it's difficult and it's unfortunate we're just kind of forced to work on the federal schedule, but I think I will share some information with Dana so that she can send an email that kind of summarizes a little bit of what I've talked about and what we're asking for, and the contact information so that you could get in touch with us if you'd like to get on the schedule to have one of these assessments done. And like I said, these are completely voluntary. They're not regulatory. It's really a resource that we really just want to offer to all of the facilities to help as they move through this response. So I think that's kind of it for right now. Does anybody have any questions or anything they would like to kind of discuss regarding this?
I wanted to mention that I put Angela's email address in the chat box for anyone who wants to reach out to her directly to set this up. Was that accurate, Angela, or would you like for me to also put anyone additional to be contacted, or are you the direct contact?
I'm the direct contact. Thank you so much. That's perfect.
Okay, great. Well, are there any questions for Angela? Okay, thank you. Well, Angela will be sharing some information for us to share with you in our updates, our update that goes out today. So be sure to check that out. And thank you so much for joining us. Sounds like a great opportunity for long-term care. So we really appreciate it. I did want to address a question that came in the chat box. When will the Department of Health release the phased opening guidance? So the Virgie responded in the chat box that the department phased reopening guidance for nursing homes is going through final review with the Secretary and the Governor's office, and we are expecting to have it posted this week. So as soon as that's available, we at LeadingAge Virginia will be getting that out to everyone. So thanks again, Angela. So now we are going to move to the topic of staff travel and how to handle that. So I'm very happy to introduce Dee Percoin with the Director of Life Plan Communities Service and Policy with LeadingAge. We also have staff attorney with LeadingAge National, Corey Kalheim. So thank you both for joining us.
Good morning, everybody. Thanks so much for having us here. It's good to be with you. And as always, we want to say first and foremost a big thank you for all you're continuing to do as we work together to figure out the ongoing challenge of coronavirus, which, you know, across the country, these are challenges that members are facing. And so we're here just to be a resource and help share some information. And to start with the staff travel topic, I'll do a part of it, and then Corey will do a part of it as well. We have a tag team on, you know, what CDC has put out regards to travel, what we're hearing members are attempting to do around this question, and then certainly the legal and liability considerations that we have to be thinking about as we go along. So I'll start off just with a summary of CDC travel guidelines. And what I'm going to do after I'm done talking is I'm going to drop some links into your chat and I'll get them over to Dana and Melissa and Paula. So afterwards, if you want to take a look, CDC has a pretty broad portfolio of resources geared towards travel and helping individuals think about the various risks involved. And we offer these first and foremost as a way for you as employers and as individuals as well as staff members to be really thinking through what are the risks with different types of travel. They have, you know, resources around domestic travel, international travel, cruise ship travel, which you may find helpful, especially if you're broadening this discussion to include residents potentially, FAQs, travel bans, and so forth. There's also a variety of downloadable travel notices that you might use or your HR teams might use just to put up in your employee break rooms to educate people about the risks of travel, because the number one thing is really making sure that everyone is clear on what are the inherent risks. One of the things we've been talking about on our calls on this topic is the reality that whether somebody's going to the Wegmans down the street or they're headed to West Virginia or the, you know, Bermuda, you know, somewhere internationally, there's still a risk anywhere we go of picking up the virus or transmitting the virus. And so first and foremost, what CDC emphasizes is no matter where we go, we still need to be practicing the universal precautions of washing hands, staying home if we're sick, social distancing, all the things that we are familiar with. And it's really important to emphasize that to your staff as they're talking about travel. You know, even if you go to the beach, you still need to be practicing all of those CDC guidelines. Things to consider though, as folks are looking at heading out on vacation, is COVID spreading where they're going to? Are they heading to an area with a lot of COVID spread, or are you leaving from a place that has a high COVID spread? And both of those things are important because, as Jody pointed out on our call earlier this week, you could be taking it with you potentially, and the locality where you're going may have requirements then once you arrive. Let's say you're coming from a state that has high COVID spread, they might say you have to self-isolate, self-quarantine as soon as you get to wherever you're going. And then if you come back from a place that has high COVID spread, same thing in reverse. Your state, your locality might say you have to self-quarantine now that you're back. So really thinking that through and checking with the local health departments. International travel, I think, is one of the most self-explanatory ones, but if there are occasions where individuals really do need to travel internationally to see family and others, so check out the international website for CDC as well as the State Department, because there are travel bans in place for certain countries, both going to and returning from. Same as domestic travel, really understand what the spread is, where you're leaving from, where you're going to, and what the requirements are when you return, because coming back internationally, you're probably going to have to self-quarantine. Also thinking about the travel method. If you're going in a car and making a lot of stops along the way, what do you need as you stop to make sure that you have PPE, that you're cleaning, disinfecting as you're using, let's say, rest areas that are certainly very public areas. Or if you're a congregate method of travel, like a bus, a train, or an airplane where you can't maybe socially distance, what are some other measures you should take or need to take to protect yourself? CDC has some great guidelines on their website. A little bit of consideration about vulnerable individuals, and Jody really emphasized this beautifully earlier in the week. We do have to remember that the people we serve are in that category, certainly of vulnerable populations, and CDC stresses this on every single one of their travel sites. If you're going to see somebody who's in a vulnerable population, or you're returning home, or someone traveling with you is in a vulnerable population, you really need to double, triple think the idea of travel in the first place, or take some extra precautions. And those could include, making sure everybody's up to date on the vaccines that are available, like measles, mumps, and seasonal flu, packing extra alcohol-based sanitizers, having non-perishable foods packed, or planning to order curbside or drive-through takeout. So when you're planning to eat on your vacation, avoiding as much as possible those congregate settings of the grocery stores and restaurants, just like when you're at home. And then being prepared to clean and disinfect your travel lodging. And they have a website on this, your hotel room, your cabin in the woods, whatever it might be. Do you have supplies, or will your staff member have supplies necessary to make sure they can clean the room before they use it, and certainly after they leave? So that's the piece, or at least in summary, from CDC. And I will drop in your chat here in a minute some links. The next section is, what are members doing? And we've been having conversations with members across the country who are trying to figure out the answer to this issue. And again, just emphasizing and reminding staff that really wherever they're going to, they still have to practice those universal precautions. So the added wrinkle of it being a vacation may or may not actually be as huge a factor as we think, depending on where they're going. And I've heard members, having very informal approaches, saying this is mainly a conversation between the supervisor and the staff member on what they're going to be doing and what their risk is. Other organizations are putting out pretty formal policies, which I'll talk about in a minute. But a lot of those conversations are centered around three core questions. Where is the staff member going to? How are they planning to keep themselves safe and protected? And what happens when they return and want to come back to work? And that's really the biggest piece that then Corey is going to dive into even more. Where are you going? We talked about this with the CDC piece, but knowing what the COVID spread is in that area, a lot of members are requiring their staff to self-quarantine upon return if they're going to a high COVID spread state or region versus a low COVID state or region. Then I hear members more often saying, oh, we'll kind of be flexible, or we'll take it on a case-by-case basis. Again, it's really important to know what your state, in this case, Virginia, requires for in and out of state travel. I know in other states, like for example, Vermont had in place up until last week, as far as I know, if you left the state and came back, you had to self-quarantine. So that means if your staff member in your state has that mandate, then no matter where they go outside the state, they have to self-quarantine. It's important for you as the employer to know really what is your state saying, and then also the staff member to understand what they will be required to do, or what is the advisory from the state. And every state has at least something out there on travel and whatnot. And I'll send you all some links on that. And we already talked about this a bit, but what is their travel method, especially if it's a congregate travel method? How are they planning to keep themselves safe on the bus, on the train, on the plane? And some members have said, if you're going by congregate travel method like airplane, bus, or train, then you are going to have to self-quarantine regardless of where you're going, because you're going to be in such close proximity to a lot of other people. So number 2, how will the staff member keep themselves safe? This is more of a iterative discussion with the staff member, again, maybe using some of those CDC travel downloadable flyers would be great for education, just so staff are really thinking through all the things they need to be prepared for as they travel. Do they have enough PPE for everybody in their family, not just themselves, but if they're taking a group with them, how will they stay safe? If they're going to visit friends, do the friends upon the location where we're headed, do they have adequate means to keep everybody safe? Because we have to remember that our staff are coming back to work with a vulnerable population, and really stressing the avoiding large crowds. I heard members talking about this even before the vacation issue came up, but just when restaurants were opening, salons were opening, gyms were opening, and having some really kind of open heart-to-hearts with staff about, you realize if you go into these areas, even if it's right down the street, any large group gathering space or public space is going to increase your risk of picking up COVID or transmitting COVID to others. So if they're going to the beach, if they're going to a cabin in the woods and everything in between, what's their likelihood of running into large groups of other people? The last question on this is what happens when the staff member gets back? And again, this is going to flow right into Corey's section about legal concerns and liability. I've heard a vast number of approaches here on what to do when the staff wants to come back to work. Certainly the symptoms check, which we're all doing anyway. Some folks are requiring testing, negative test results, 1 or 2 potentially negative test results before coming back to work. Some are requiring immediate self-quarantine, just A, if they're going anywhere, B, if they're traveling by congregate method, C, if there's a high COVID spread where they're going, coming back from, or if their state requires it. And then there's the question, and Jody raised this when she was talking about it on the national call, the paid versus unpaid self-quarantine. So let's say a staff member goes to a place and comes back and they have to self-quarantine either because of the state, your policy, or they get sick. Who pays for their leave, when they come back? Do they get to still use paid leave? Is it unpaid time? I hear members taking both sides of the coin on this, some just going ahead and paying if they have the PTO or vacation time to burn, or letting them just get paid time, or others who are saying, if you travel and you made that choice and now you have to self-quarantine, then it's unpaid time. So something to give some deep thought to. And then on the very end of that spectrum, I've even had a couple members play with the idea of, is this then voluntary termination of employment if, they're in a high COVID spread state, the staff member is going to a high COVID spread area and they're required by their state to self-quarantine for 14 days. If that amount of time is above and beyond what your already stated leave policy provides for, a couple members have played with the idea of saying, well, then if you choose to still go, then this is essentially a voluntary termination of employment. And so that, like I said, it ranges between really informal, more conversations, all the way to the very formal, very conservative approach, depending really on the state and what's going on. So with that, I am going to turn it over to Corey, who's going to walk us through some of the legal and liability considerations.
Thank you, Dee. Yeah, I'm just going to touch on kind of 3 topical areas, legal and practical considerations that you really want to think about when you're addressing your current vacation policy, and especially if you're planning on making some changes to your PTO or vacation policies during this time. And the first is simply just to be aware of state and federal laws. The second area is fairness and consistency, treating employees fair and consistent when you're dealing with these policies. And then I think the final one is just clear communication, and this is a good practical tip when we're dealing with vacation times during this era. I mean, scheduling vacations in the summer is difficult in normal times, but during this pandemic, it's even more of a challenge dealing with the issues of that Dee has laid out prior here. So first of all, on the state and federal laws, you just need to be mindful that when you're dealing with the PTO and vacation, and especially if you're making changes, there's federal laws and state laws that may come into play. So just be mindful of that. I do not envy the HR folks at this time, especially when you have the new, the Families First Coronavirus Response Act that was part of passed as in response to COVID-19, which deals with some leave provisions, and then you've got some changes that were made in the CARES Act, and those actually interact with all your other federal employment laws. The FLSA, Fair Labor Standards Act, the Family Medical Leave Act, and then just your wage and hour provisions. So just be kind of mindful that if you're going to make certain changes, they need to comply with all those other regulations, not only federally, but on the state level. The state level may have some changes, particularly if you're going to make a real overhaul of your vacation time. There's typically notice provisions that are required on the state level for sure. And so you need to know if that's a 30, 60, 90-day notice that you need to give to employees to make certain changes to any vacation policies broadly for your staff. And then finally, if you are a unionized workforce, you need to actually look at your union contract to see what types of vacation policies may rule that relationship as well. So you've got all those different considerations to think about when you are looking at your travel and staff vacation policies. What we noticed the other day, we did a little poll during one of our national calls, and most folks had not had a restriction in place as far as or changes to their travel plans, or they were looking at them on a case-by-case basis. And so when you're looking at these on a case-by-case basis as they come up, it's really important then on these next two items for the fairness and consistency and clear communication to really be paramount when you're addressing the vacation time. So when you're dealing with the paid time off and you're looking to treat folks fairly, I think it's important to look at your different type of workers or classifications that you have, because if you are a frontline staff worker and you are going to an area that is a high COVID spread and then you need to quarantine, you can't effectively do your job at home. If you're in a management position and you go on vacation, you need to self-quarantine, you may have already been working from home, so that's not nearly as big of an issue. You're able to jump right back in and not take any more leave time. So I think that you need to really look at that. And then when you're dealing with those frontline staff or other staff that are in the same classification, you need to be consistent across the board on how you treat them and how you are granting vacation time in that sense. And so I think that that's just a tip, and HR should be aware of that, but you really need to pay attention to that as you look at these policies. And then finally, this clear communication about any changes or how you're addressing or laying out guidance for your employees, if you're giving them suggestions or just gentle reminders. I think the clearer you can communicate what you're doing and why you're doing it, the better off you're going to be. This is a very difficult time for everybody. And I think if you need to clearly communicate that if they're going to go on vacation, when they come back, they're going to be subject to the same screening and or testing policies that you have, and to keep in mind that your vacation policy needs to fit within your general screening, testing, whatever policies you have in place, education that you have for employees, because vacation is not the time to let their guard down. Especially if they all want vacation, they all need time away, but it's certainly not the time to wholly abandon any social distancing, wearing masks, washing hands, and all the other protocols you'd expect of your employees, whether at work or off work during the non-vacation time. So I think the communication and laying that out to the staff is going to be paramount to get through this. And I've seen different organizations, as Dee mentioned, have done it different ways, but as long as it's clearly communicated, everybody's on the same page, and it meshes with the culture of your organization, I think that's the best approach. So I'll turn it back to Dana to see if we have any questions.
We do not have any questions in the chat box, but I just wanted to open up the floor to see if anybody has any questions. They don't necessarily have to be in the chat box if you would like to ask them. That was a really great presentation, and I think probably triggered a lot of ideas and questions. So I just want to provide this time. Corey, does LeadingAge have any templates or sample policies that they've shared around staff travel that we could share, or are you all working on anything of that nature?
You know, we don't have any templates as far as staff policies because those are going to be specific to each state. But we do, the D is actually working on a kind of an outline or overview for folks to think about when they're dealing with staff vacation and some reminders. And I know that that should be out very soon.
Okay, great. Well, we'll definitely look forward to that and share that. Yeah. Did you have anything to mention, Dee?
I do, and thanks, Corey. Yeah, so we'll have that posted. Also, if folks are interested, I'm aware of a couple of members. The first one that comes to mind is Hebrew Senior Life in Massachusetts. There are a few members like them who have great resources up on their public share section of their website. So while we're talking, I'll go dig up the link. But if I remember correctly, not only do they have a great phased reopening template that they're openly sharing, they also have a bit about staff travel. And I'll go back and look. I've had a few other members share directly some of what they're working on. So those kinds of things we can try to make available just as samples or as examples of what other members are doing. So here in a second, I'll go see if I can find the Hebrew Senior Life link, and then I can send other things to you, Dana or Melissa, that come out.
Okay, great. And we will definitely share those in our daily update. So we have a question in the chat box. Our council has advised under FFCRA, since that what we did not opt out in for, employees are automatically eligible for paid leave, even if they undertake a risky vacation. Any thoughts about that?
Yeah, I think that's the smart way to do is run that through council, because depending, like you said, if they under that law, you could opt in, opt out, and there were certain variations. And so that's why I think for each individual organization, you need to think about how these all interact with each other. And I'm not an expert on the FFCRA, but I know that, and I'm not an HR expert, but that's why I think it's very important to sit down and look to see how these all interact with each other. And so in that instance, if that's probably the case, is when they might not be able to stop that quote unquote risky vacation in that sense. And so, but that also may play into their other leave policies, as well as how much other leave they have in certain other pots.
Thank you. Sounds like an interesting topic for one of our future weekly calls, so we may consider that. Well, we do not have any questions coming in from the chat box, but thank you, Dee and Corey. That was really helpful. We appreciate you taking the time. I just want to give one more opportunity for questions. It looks like we'll be able to end a little early today, but I don't want to end this opportunity if someone would like to raise a question or an issue at this time. And I see that Dee has put the Hebrew Senior Life Open Resources site in the chat box if you want to grab that, and we'll also have that in our update today. Well, thank you so much, everyone. Our next call will be at 11 a.m. on June 24th, and we hope to have the Department of Social Services on that call talking about guidance for reopening assisted livings. So thanks to everyone, and hope you have a great rest of the week.